everybody, and welcome to another episode of Manipal Podcast. This time we have with us Dr. Durgaotosh Pandey, who is heading the Surgical Oncology Department, who is here with us to create awareness about cancer. Welcome, sir.
Thank you. Thank you.
Today we are going to talk in depth about how cancer awareness is important, what are the different normal questions that most of the people have around in our medical society. The patients have the most commonly asked questions. We're going to talk in depth with sir about it. So this year's theme is Unity in Uniqueness. So would you like to shed some light on that?
So as far as the context of cancer is concerned, it is a diverse kind of a disease, but there is a common thread which runs through all kinds of cancers, and that common thread is that it's a disease which should be detected at an early stage for an optimal outcome. The other one is that most of the times it requires the inputs from multiple specialties for treatment. And finally, it's a long haul for the patient, and the patient and the support system of the patient should be geared for the adequate treatment of that patient. So these are the common threads that run through all the patients who have cancer. And it's a disease that has to be fought on several fronts by several people, including the patient, the family, the friends, and of course the doctors, the nurses, and the hospital system.
So everybody has to be equally involved to make sure that the patient is feeling alright at all angles. That's something which is very important, and that's our agenda of today's conversation. So I'm going to ask a few thoughtful questions to sir, and let's see where the conversation goes. So I have penned down a few questions which I have seen that are commonly asked by patients to you, I'm sure, and few of my fellow colleagues. So what are the common types of cancers that people should be aware of in their lifespan?
So the commonest cancers are the cancers of lung. The oral cavity is a very important cancer in India, where the tobacco chewing prevalence is very high. The cancer of the prostate is another common cancer. The cancer of the gallbladder is a common cancer in the northern part of the country, which has a great geographical variance, and it is very rare in the south of India and is very rare in the west. In women particularly, the cancer of the breast is a very common cancer nowadays. The cervical cancer, the cancer of the cervix, used to be very common a few decades back, but now the incidence of that cancer has decreased quite dramatically. So basically what we are looking at is the cancer of the mouth, oral cavity, the cancer of the lung, prostate, breast in women. These are a few cancers which are very important in our country's context, and cancer of the gallbladder in the northern part of the country.
So as you mentioned that cancer of the gallbladder is majorly prevalent in the northern side, not much in the southern side. Is there any specific reason behind it that we can?
So there must be some reason. We are still not very confident about that. There are several speculations. There might be some genetic factor. There might be some factor related to the water toxicity in the major rivers like Ganga and Brahmaputra. There might be some dietary issues. Some people have said that maybe mustard oil may lead to this. Nobody is sure as to what is going on. Some people have looked into heavy metals in the major rivers of the country. So we really do not know. But yes, the truth is that the geographical discrepancy between the northern India and the southern part of India is huge. And this disease is not seen in many parts of the world.
It's one of the rarest.
Yes.
So what role does genetic plays into the cancer risk in any of the families that we see in countries?
So when we talk about cancer in general, we generally say that about 5% of all cancers would have some hereditary predisposition. Now when we say genetics, in lay terms, they understand it as hereditary. So if you ask me technically, every cancer is a genetic disease, because every cancer is preceded by some kind of a genetic mutation in the genes. which has to happen for a cancer to develop. But it is not necessarily hereditary. Hereditary means that is it passed on to the next generation. So when lay people talk about genetic, they actually mean hereditary. And if we are talking about hereditary predisposition of cancers, about 5% of all cancers would have some hereditary predisposition. It has been studied in quite detail in breast cancer and in certain other kinds of cancers also. So this is particularly the numbers, and we look into what kind of mutations are actually, they go across generations, and that's, for example, BRCA1, BRCA2 patients in breast cancer. So these are breast and ovarian cancers. So these patients would be quite prone to having breast and ovarian cancers. So nearly 5%. It's not a very big number, but looking at the explosion in the number of cancer diagnoses, that number is quite significant.
As you mentioned that the prevalence of cervical cancer has decreased with time, that's because of the vaccination that we see, or it's because of the general hygiene and other awareness that we are able to create?
I have been asked this question several times. I'm sure the vaccine will take the credit, but actually the credit is not the vaccine. Neither the credit goes to the screening. We would be very happy to say that our screening efforts have led to reduction in cervical cancer incidence and mortality. But if you ask your own friends and colleagues, etc., how many of them, the people in their families, would have had